Hi, I'm Dr. Lokesh Kumar, Director and HOD of Department of Plastic and Cosmetic Surgery at BLK Memorial Super Speciality Hospital. Particularly if we talk about hair transplant, we have a world-class center which provide and cater to the need of society of giving the best kind of hair transplant results in our population. We also covered other cosmetic surgeries like breast augmentation, breast reduction, tummy tuck, fat grafting, fat liposuction. All these things are done under one roof by our department, and we have this facility which is world class for this. Basically, if you see the causes for the hair loss can be categorized into four different categories. And first and foremost is the genetic factor, which takes precedence over the other causes. But that is not the only factor, and that is the one factor which you can't modify. There are other factors like nutritional factors, like hormonal changes, like your scalp condition, diseases in the scalp like dandruff. All these are treatable causes for the baldness, and they also account for a number of cases. Considering our diet, considering our environmental impact on these younger patients who are coming more and more numbers to get the hair transplant done. So we can do a lot in terms of if you say medical treatment as well as surgical treatment of hair transplant for the people who have already lost the hair and which cannot be recovered through the medical means. Any patient, any age, if he doesn't have any concomitant medical condition, or even if he has any concomitant medical condition, it should be well under control with medication like diabetes, like hypertension and all. But if the person is healthy and if he is in the age group of about 18 to 40 or 45, the results are excellent. So they make very good candidate for the hair transplantation. The second criteria for choosing the person for hair transplant, that he should have sufficient donor area in order to give him the kind of result which we want to give to everybody who seek hair transplantation from us. So basically these are different criteria. The scalp should be free from diseases like dandruff and all, or there should not be any boil or any infection in the scalp. If it is there, then we would like to pre-treat the person. And pre-treatment is also recommended for people who are having an active hair loss. That means the hair are continuously falling, and we want to treat it first before doing any transplantation, because we want to retain those hair which are transplanted by doing the continuous medical treatment in order to get a long-lasting result. You can't take hair from somebody else, number one, that should be clear, because the hair which we transplant they should be your own hair, because somebody else's hair, the hair which are transplanted are going to be rejected from the body because of the immunogenicity. Now your own hair, when they are transplanted, once they are transplanted, they start growing in about 3 months time. And once they start growing, they continuously grow for rest of your life. They grow like your own hair. You can cut them, you can shampoo them, you can style them, you can gel them. Anything you want to do with them, you can do. You can shave them, they will regrow back. So basically they are your own hair, which are going to be your own hair in a natural way. They are going to grow in a natural way. So these are basically things which you should remember. But the problem comes in people who don't have any sufficient donor area. So even if they have less donor area, what we can do is we can do a combination of donor areas. The other donor area in the body are the next best. From the best is the scalp, and the next best could be the beard, because the beard hair can grow like a normal hair and then can achieve the length. But people who don't have any much hair, we can also have body hair transplantation. We can do take the donor area as chest area from the arms, but naturally those hair quality is not as good as the scalp hair, and they are not expected to grow like your scalp hair. So there is a limitation of rest of the donor area. Nevertheless, they are there if somebody is very desperate to have. But those hair are very good donor area for transplantation into mustache, transplantation into eyebrows, transplantation into somebody having post-burn scar, post-burn alopecia, the scalp post-burn. So those are very good donor area for those kind of conditions. The first thing is because we encourage the patient to come for initial consultation. And initial consultation is done by a senior consultant plastic surgeon, obviously, in our department, and then we explain what are the types of hair transplantation technique, what are the condition of the hair, how is the donor area, what is the pattern of baldness, how many hair graft we expect to transplant in that patient. All these things are assessed on the initial consultation, and a thorough explanation is done to the patient as to how we go about it. Now, on the day of transplantation, the person comes in the morning. We start early morning because it's a very long procedure. It takes about 8 to 9 hours to complete one single sitting for hair transplantation. We call the patient at 7:30 in the morning, and he comes with light breakfast. And because the procedure is done completely under local anesthesia, there is no general anesthetic is involved, so patient can eat and come. On the day of surgery, we take his before pictures and we again explain to him the procedure. Now there are basically two techniques of doing hair transplantation. Both techniques are done in our department, and both techniques have their own pros and cons. And one technique is called follicular hair unit FUT, which is called follicular unit transplant. Now this technique is very age old and standardized technique, which is gold standard in hair transplant surgery, which is followed in about 80% cases in about 80% centers all around the world. And the reasons are obvious, because this technique gives you the best available density in one single go. In this technique, what we do is we harvest a strip of the scalp from the back of the head, which bears the hair, and the measuring the technique, we take maximum of about 20 to 30 centimeter, and width of the strip is about 1 to 1.5 centimeter. We see the scalp laxity on how much we can easily close, and though that strip is removed and the donor area is closed by applying the sutures. Now the sutures are applied in such a way, the technique is advanced in such a way that it does not give any kind of donor area scar, or even if a scar is there, it is not noticeable, and even if the hair are about 2 to 3 millimeter long, you can barely see that scar if you shave the scalp. Now the specific technique which we use for closure so that there is no donor scar is called trichophytic closure. In this particular technique, the hair grow through the scar, so making the scar not noticeable. Because our aim, we strive to give kind of perfect hair transplantation, and perfect hair transplantation is the one in which the donor area has no or minimal problem at all. The second technique is called FUE, which is again is a very good technique in which we individually pluck the hair and transplant it into. The transplantation technique in both the method is same, only the donor area, the harvesting is different in both the techniques. Follicular hair extraction, again, it has limitation that you can't do a large number of grafts, like 4,000 grafts in single go. With this technique, you will have to limit to about 1,000 to 1,500 grafts in single. So there are multiple sittings may be needed if you want to undergo the FUE technique. These are the basic drawbacks, and then again, the donor area has to be very large in FUE, because when you are extracting hair, you want to leave 1 or 2 hair in between so that the area does not look bald. As contrast to the FUT technique, in which there is no donor area baldness, because the donor area where we harvest the strip from is closed primarily, so there is no visible loss of the hair in FUT technique. In FUE technique, if you see very carefully, there are dot of the missing hair roots from the area. So these are the basically two techniques which we follow, depending, every case is different. Sometimes we do combination of these two techniques in order to maximize the hair transplantation session. In FUE, you can go maximum up to about 2,000 grafts in one sitting. And that is a good amount of hair transplantation session if you go for FUE. But you can repeat these sessions after about a month or so when the donor area is ready again. So repetition in FUE or FUT even is not a problem. You can have multiple sittings, but definitely FUT gives you more density in one go rather than FUE. Person who comes in the morning, because the procedure is done under local anesthesia and lasts for about 5 to 6 hours, the person is very comfortable sitting and getting it done, chatting, having tea breaks, having lunch breaks. He can watch TV, he can listen to the music. So basically these 5 to 6 hours is not a burden. You know, he is enjoying because he wants that procedure done, and most of the people seems very comfortable with this kind of time period which is given for the hair transplantation. They are not bored, they are not, you know, and they are the candidate who want it. So they are the candidate who are, you know, devoted kind of clients, and they can go through this procedure very easily for 5 to 6 hours. So this is another room which is, we named it hair transplant 2, in which we bring the strip after harvesting, and basically this strip is transected into many pieces here, and those hair follicles are extracted out of that hair strip under the magnification of microscopes. We have 6 microscopes here, and the 6 technicians work together to minimize the time taken into the hair transplantation. Come, I'll show you microscopic technique in detail before we move on to another area of hair transplantation. USP of our hair transplant center is that we do the procedure under microscopic magnification. There are many advantages of doing hair transplantation under microscopic magnification. The first and foremost is that the quality of hair transplantation improves because the transection rate of the hair follicle becomes less and less. The second advantage is that when we are having many people who are dissecting under microscope, like we have 6 microscopes and 6 people working together, the speed of the hair transplantation increases, and with the speed, number one, the time factor of doing hair transplantation, it becomes less. It gives advantage to the patient. That patient remains more comfortable because then it is not a very lengthy procedure. The second technical advantage which we get over the traditional hair transplantation is that the hair follicle which is extracted out of the body spends very little and a small time outside the body, and we call it the ischemia time. And the ischemia time, when it is kept minimum, the result is far better because then there are more percentage of the hair which regrow, and we claim about 99 to 100% growth rate in our hair transplantation cases because of these microscopes which we use in our center for dissecting the hair follicles out of the hair strip which we harvest. So basically, in order to explain this procedure which is done under microscope, you have to understand these microscopes give us a variety of magnification like 5 times, 10 times, 20 times to the original which eyes can see. And if you see the gentleman who is working with under microscope, he is trained to extract these hair follicles under magnification of microscope. He is using very fine instruments if you see, and he is using proper sterile techniques, wearing the gloves which are like, if you see these gloves which are sterile gloves, the green sheets which are applied here, they are all sterilized autoclave sheets. So the procedure is done in absolute aseptic techniques in order to minimize any kind of infection rate. The instruments which are used for this procedure are very fine. You can see this forceps which is kind of very fine jeweler forceps which is used for dissecting these hair follicles from under the magnification of microscope. And we have about 6 microscopes, so the time that there are at one time there are 6 technicians which can work to remove this hair follicles from the strip, minimizing the time which a hair follicle spends outside the body before it is transplanted again. We have two operating rooms basically for hair transplantation. In this room, what we basically do is extract the strip, and then there is next room which is used for transplantation. I can show you the glimpse of the procedure which is being carried out here. Number of people who are working under the magnification, and there are qualified plastic surgeons and technicians which are working. Patient is lying and sleeping nicely, and the procedure is being carried out here under the aseptic techniques. This is another room where we bring the patient after we have harvested the strip, and this room is basically used for transplanting the hair. Patient lies. The room is not prepared as yet because patient is not ready to come in yet. So you can take advantage of taking a close-up shots. Patient lies here. We can watch outside. We have a perfect view. And this chair is basically meant for making the patient more comfortable. He sits here and it makes his position such that he can actually undergo the long procedure without any discomfort.